If you're over 60 and you feel like walking just isn't giving you the strength, balance, or confidence it used to, this message is for you. Many older adults are told the same simple advice. Just walk more. Walk for your heart. Walk for your legs. Walk to stay independent. And walking is good. No one is saying it isn't. But here's the quiet truth most seniors are never told. After 60, walking alone often isn't enough to protect your legs, your balance, or your ability to get up from the floor, a chair, or even the bed. That's not a failure on your part, that's biology. As we age, the body changes in very specific ways. Muscles don't just get smaller, they get slower to activate. Joints lose some stability, and the deep support muscles that protect your hips, knees, and spine can quietly weaken, even if you walk every single day. This is why so many active seniors are shocked when they suddenly struggle with stairs, or feel unsteady stepping off a curb, or find it harder to rise from the floor. They say, "But I walk all the time." Here's the missing piece. Walking mainly moves your body forward. It doesn't fully challenge the muscles that help you stand up, sit down, stabilize your hips, or catch yourself if you stumble. Those abilities come from controlled, low-impact movements that train strength, coordination, and balance together. And surprisingly, some of the most effective movements don't happen standing at all. They happen on the floor. Now, before you tense up, let's be clear. This is not about intense workouts. It's not about forcing your body into painful positions. And it's definitely not about exercises meant for young athletes. These are gentle, supported floor movements that surgeons and physical therapists often favor for older adults because they reduce joint strain while quietly rebuilding strength where it matters most. The reason they can outperform walking isn't because walking is bad. It's because these movements address what walking misses. They wake up dormant muscles. They improve how your brain talks to your body. And they help restore confidence in everyday movements like standing, turning, and reaching. Many seniors who add the right floor exercises say they feel more stable within weeks. Not younger, not invincible, just steadier, more capable, more in control. And that sense of control is everything after 60. Because independence doesn't disappear overnight. It fades quietly, one small limitation at a time. The good news is, the body still responds to the right signals at any age. You just have to send the right ones. In a moment, I'll explain why so many well-meaning seniors unknowingly train the wrong way, and how a simple shift can make daily movement feel safer and stronger again. But first, you need to understand the biggest mistake almost everyone over 60 is making without even realizing it. Let's talk calmly and honestly about what changes in the body after 60, and why so many active seniors still feel weaker or less steady over time. As we age, three important things tend to happen together. First, muscle fibers shrink and become less responsive, not just from inactivity, from aging itself. Second, the communication between your brain and your muscles slows down slightly. This affects balance, reaction time, and coordination. Third, the muscles that stabilize your joints, especially the hips, knees, and lower back, often weaken faster than the muscles used for simple forward movement. Walking mainly works the same muscles over and over. Hip flexors, calves, some thigh muscles. That repetition is fine for circulation and heart health, but it doesn't fully train the muscles that help you lower yourself down, push yourself up, or stabilize when your balance is challenged. This is where many seniors unknowingly make a mistake. They believe more walking will fix weakness, so they walk longer, they walk faster, they walk more often. But the body adapts only to what it's asked to do. If you never practice getting up from a low position, that skill fades. If you never challenge side-to-side stability, balance weakens. If you never gently load muscles through a full, controlled range, strength slowly declines. Another common mistake is avoiding the floor altogether. Many older adults stop sitting or moving on the floor because they fear not being able to get back up. That fear is understandable, but avoiding the floor actually accelerates weakness. The ability to transition from the floor to standing is one of the strongest indicators of long-term independence. Not speed, not endurance. Control. Floor-based movements allow you to train that control safely, without impact, and without stressing the joints the way standing exercises sometimes do. Another issue is joint protection. After 60, joints often tolerate slow, controlled movement better than repetitive pounding. Walking on hard surfaces can irritate knees, hips, and lower back, especially if posture or gait isn't ideal. Floor exercises reduce body weight load. They allow muscles to work while joints stay supported. This makes them ideal for seniors who want strength without soreness. There's also the balance factor. When you exercise on the floor, the risk of falling is lower. You're already close to the ground. That allows the nervous system to relax and focus on proper movement. A relaxed nervous system learns faster. It builds confidence, and confidence improves movement quality. Many seniors also make the mistake of thinking exercise has to be tiring to be effective. That's not true anymore. After 60, consistency matters more than intensity. Small, daily movements send powerful signals to the body to maintain strength and coordination. Finally, there's the belief that it's too late. This is one of the most damaging myths. Research and real-world clinical experience consistently show that older muscles still respond to gentle resistance and repeated practice. They may respond more slowly, but they do respond. The key is choosing movements that respect aging joints, reduce fear, and rebuild foundational strength. That's exactly where the right floor exercises shine. In the next part, I'll walk you through simple, surgeon-approved floor movements that many seniors can safely practice at home. They don't require equipment, they don't require flexibility, and they don't require getting down on the floor without support. Each one builds strength, balance, and confidence step by step. And when combined, they can quietly outperform walking for protecting independence after 60. Now let's talk about what truly helps. These are not extreme exercises. They are slow, controlled floor movements commonly recommended by surgeons and physical therapists because they build strength while protecting joints. Always move within comfort. Use a sturdy chair, couch, or wall for support. And remember, slow is powerful. Exercise 1. Supported floor sit back. This movement trains one of the most important skills after 60. The ability to lower and raise your body safely. Start by standing in front of a sturdy chair or couch. Place your hands on the armrests or seat for support. Slowly bend your knees and hips, and lower yourself down until you gently touch the seat. Pause for one calm breath. Then press through your feet and hands, and stand back up. Now, here's the key. Do not drop, do not rush. Lowering slowly strengthens muscles more effectively than standing up fast. This exercise activates the thighs, hips, and deep core muscles that walking barely touches. Begin with 5 slow repetitions. Rest. Work up to 10 over time. Exercise 2. Floor bridge with support. This one strengthens the hips and lower back, essential for balance and walking stability. Lie on your back on a mat or carpeted floor. Bend your knees. Place your feet flat, about hip-width apart. If getting to the floor feels difficult, use a couch or bed to help you down. That's perfectly fine. Place your arms at your sides. Slowly press your feet into the floor and lift your hips just a few inches. You do not need to go high. Comfort comes first. Hold for 2 seconds. Then slowly lower back down. This movement wakes up muscles that protect your spine and hips. Start with 5 repetitions. Gradually build to 10. If needed, place a pillow under your hips for extra comfort. Exercise. 3. Side lying leg lift. This exercise improves side-to-side stability, something walking barely trains. Lie on your side with knees slightly bent. Support your head with your arm or a pillow. Slowly lift your top knee or leg just a few inches. Keep movements small and controlled. Pause briefly. Lower gently. This strengthens the hip stabilizers that help prevent falls. Do 5 lifts on each side. Work up to 10. If lying on the floor isn't comfortable, this can also be done lying on a firm bed. Exercise. 4. Seated floor reach. This trains coordination, flexibility, and core control. Sit on the floor with legs bent, or sit on a cushion if needed. Place one hand on the floor behind you for support. With the other hand, slowly reach forward toward your knee or shin. Return to upright. Alternate sides. The goal isn't stretching, it's controlled movement and balance. Perform 6 to 10 slow reaches. This helps retrain movement confidence and reduces stiffness. Exercise 5. Assisted floor-to-stand practice. This is one of the most valuable skills you can practice. Using a chair, couch, or wall, practice moving from a kneeling or seated floor position back to standing. There is no rush. There is no right way. What matters is learning how your body moves safely. Practice once or twice per session. Even practicing part of the movement builds strength and confidence. How often should you do these? 3 to 5 times per week is enough. More is not better. Consistency matters more than effort. Many seniors notice improved stability within a few weeks. Not dramatic, but meaningful. In the final part, I'll explain why it's never too late to regain strength, how small daily habits protect independence, and how to stay motivated without fear or pressure. If you've made it this far, there's something important you should hear. Your body is not done changing. It is still listening, still adapting, still capable of improvement. After 60, progress doesn't come from pushing harder. It comes from moving smarter. Every slow, controlled movement you practice sends a message to your muscles and nervous system. It says, stay active. Stay connected. Stay ready. That message matters more than miles walked. Many seniors worry they've waited too long. They worry weakness is permanent. But in clinical settings, gentle strength and coordination work often brings back abilities people thought were gone. Not overnight, not dramatically, but steadily. And steady progress is what protects independence. You don't need perfect form. You don't need long sessions. You don't need to feel exhausted. You need consistency and kindness toward your body. Some days will feel easier than others. That's normal. Listen to your body, not your fear. Even 5 to 10 minutes on the floor can help maintain the skills that matter most. Standing up, sitting down, stabilizing yourself, and moving with confidence. Walking still has a place. Fresh air matters. Movement matters. But when walking is paired with the right floor-based movements, your body gets a fuller message. A message of balance, strength, and control. That combination is powerful. The goal isn't to be younger. It's to be capable. Capable of getting up without worry. Capable of moving without hesitation. Capable of living without constant fear of losing strength. If you choose just one thing to take away from this, let it be this. Avoiding the floor doesn't protect you. Learning to move safely on it does. Start small. Go slow. Use support. And remember, Improvement after 60 isn't about doing more. It's about doing what matters. If this information helped you, share it with someone who might need reassurance today. Your strength is not gone. It's simply waiting to be invited back.